Hello, this is Dr. Arhiri at Premier Smiles. We get a lot of questions about all-on-4s. All-on-4 is a cutting-edge method of replacing someone's teeth, which is done basically in one visit. Requires a lot of preparation ahead of time, and then patient comes in one time. We do it under general anesthesia with an anesthesiologist on site, and then leaves with the teeth in their mouth. All-on-4 means basically replacing all the teeth on one arch or both arches, and then place implants. And then over those implants, a fixed prosthesis is attached to the implants the same day. Pros of all-on-4s are the fact that it's a wonderful way of replacing the damaged, missed, worn down teeth with a fixed prosthesis, which feels natural, feels like your natural teeth, and they would last you a lifetime. The downside of this primarily is financially, which is costly because of all the parts, components that are involved into the whole process. The candidates for all-on-4 implants are in general people with periodontal disease with a lot of missing teeth, with a lot of worn down teeth, decayed teeth beyond repair, which at that point the only other option would be with dentures, but dentures have a lot of downsides. A candidate wouldn't be ideal for an all-on-4. It's if they have medical conditions which they can affect their bone, diabetes, they take different medications which they have side effects regarding that. Smokers, ideally, they're not really good for that either. So the first step to analyze and to figure out if you're a candidate for that, we would require a 3D scan, which allows us to see the condition of your bone, of your jaw, if there is sufficient bone to be able to place safely and accurately those implants. After the scan is done, then a whole process which involves taking impressions for study models, pictures, x-rays, and all that, all together would help us out to treatment plan, to make the right plan for the right patient and to deliver safely and secure and fast the implants the patient needs. Once that's all done, the financial part is discussed with the patient as well, and then the day of the surgery is set up, which, like I said, involves an anesthesiologist for putting the patient to sleep. Prior to that, the anesthesiologist is going to contact the patient to discuss all the medical conditions and medications that the patient might take. And then the day the surgery comes, the patient is put under general anesthesia and monitored closely by our anesthesiologist. And then the dentist with his team are basically taking care of removing all the teeth and placing the implants. The whole process takes about close to 3 hours per arch. And then after 3 hours, the patient is brought back to a normal status with the temporary teeth in their mouth, which look pretty much like the permanent ones. The healing process is different for different patients. Some patients heal faster than other patients, but in general, the healing process would take pretty much a week to 2 weeks. We do suggest patients and advise them on how to take care of their gums, prescribing mouthwash, using soft foods, don't chewing anything really hard to kind of overstress the implants in the first couple of weeks after the surgery. First of all, the all-on-4 or all-on-6 or all-on-X, they would last you a lifetime, assuming that the patient takes care of it as they would be their normal teeth. They come up for the regular follow-ups every 6 months for their regular checkups and cleanings to monitor closely their mechanics, their bite, and to make sure there's no other signs of any kind of periodontal disease. If all of these are kept under control, then the patient is going to enjoy the implants with prosthesis for the rest of their life. I hope I answered all your questions. And if you have more questions or if you're interested in the procedure, please give us a call at 610-647-7611. Have a wonderful day.